Hello, everybody. It's January 3rd, 2024, and this is the next in the health illness update series. And this one, at least by my count, is number 18. So thanks for being on this journey with me. I think that my last update was September 20th of 2023, and that was a couple days after I saw my oncologist. So, thank you. I'm feeling all right. I have a lot more ahead of me, but I haven't gotten the worst kind of news. So that's the short version, and Barely Bear is still doing great. He just got his COVID booster. I don't have very good lighting in here, but that's what we got. Good job, Barely Bear. So I'm just going to look at my calendar and scroll through, and that perhaps can remind me of which medical visits happened. So what do we say? September 18th was Dr. Stein, right? Right after that, I went down to Philly area to teach, so that was a big trip for me, big journey. Took the train. Wonderful sessions, both as a student and a teacher. But boy, it took it out of me just taking a train down there and being on for so long. But I'm glad I was able to do it, and I'm glad I did do it. But it also still took a lot out of me. So doctor's appointment. So the next one I had was with my nurse for my hepatitis B part 2 vaccination. So I think it's a set of 3, and that was my number 2. We had some issues with getting that one scheduled. It had to be changed around. But I also got my flu shot at the same time. That was October 3rd. The very next day, I went for my abdomen and pelvis CT scan. The day after that, I saw the pulmonologist, Dr. Corwin, which I think I've seen her twice since then, so this is the first of 2, I think. And, that was, again, addressing the cough. Again, feeling like the cough wasn't caused by anything here, so thinking that it's a GERD situation that I don't experience as heartburn. She seems to think it's slight. One of the things on that CAT scan was, when I first started this thing, they do the CAT scan, and it was basically, shoulders to pelvis, kind of, the whole, I guess they do chest, abdomen, pelvis, or the 3 sort of, non-head ones, I guess. And so they did them all, and very early on after they see the cancer, I think among their first questions is, where else has it gone? So they do the CT scan as part of that. And one of the very, very, very early on, they're like, well, we see these different, I can't remember the term they used, if it was lesions. I don't think they used the term lesion or nodule, but suspicious things in the lungs, but like minor. And they were quickly reassured me, like, wow, you know what, everybody has something that is sort of non-homogeneous in the lungs. So nobody was really concerned. Then I started chemo, and we saw the tumors shrink, although I can't say I recall if the tumors shrunk. I know that the tumor on the hepatic dome shrunk. So I know that the liver tumor shrunk, but I don't know if the intestinal one shrunk. I just don't think I ever asked that. But they didn't see any shrinkage or change in those. And I've had a whole bunch of CAT scans, and they kept saying, it's the same. So then they're thinking, well, it's just, part of life. I've always been a non-smoker and didn't live above a chemical factory and stuff, so didn't really think much of it. But one of my last CT scans, and it might have been this one in October, but as I scrolled through, it was the most recent one I had. So I think it was this one, October 4th. They did say that one of the nodules, is I think how they called it this time, had grown by, as I recall, some small amount. I think they said 2 millimeters or 2 to 3 millimeters, something like that. I can't remember though. But they said, look, the CT scan isn't giving us a three-dimensional view that I think an MRI would give, and also the resolution. We're talking about something that's right at that resolution. So the fact that now we see a different number, in other words, the first time we've seen a change, and I've had a lot of CT scans, and every time they check that, and there's no change. This last time, which I think might have been this October 4th CT scan, one of the nodules or whatever had changed, but not enough, like that I'm symptomatic, not enough that they're sure that it even did change because of resolution and certainty through CT scan, and not enough for like surgical intervention or to return to chemo or something. So basically it was like, oh, this could be worrying, but nobody's worried yet, and we don't have enough data. And that's still where I am today. Anyway, so I saw Dr. Corwin, and my cough had returned at one point. I don't know if it was by this date. I think it was by this date. So we changed up some medicine, and then I saw her again, I want to say the end of November or start of December. And then the medication that we tried here on the 5th of October seems to have helped what we, again, think is the GERD. But I still don't understand why, way back when I saw her, she thought it might have been GERD after we did all these other tests and so forth. And for some reason, it just suddenly returned, as if I stopped taking the medicine or the medicine stopped working. Like it just immediately just stopped, and I didn't understand why. So I wanted to see her again, and I think this is the one where we talked about it and decided a different medication to try, which subsequently seems to have worked. So I'm back to the place where I think I do think it is GERD, and we've addressed it, but I don't know why the previous method of addressing it seems to have suddenly stopped. But I think on this one, October 5th, when I saw her again, I think in 4 weeks or something, the idea was to do a lung function test just in case. So I think I'll get to that, as I scroll here. So what I'm doing is just going week by week, and I can see in this all my health appointments are in yellow, so I'm just looking for yellow. So Sunday, the 15th of October, I did a blood draw for the phlebotomist, which I think is for Natera. So I guess I'll talk about that. So October 15th, so I think that's the last one. So the last one was a ctDNA test. This is the test where they look for circulating tumor DNA, is what it's called, ctDNA test, where they're looking for a match to the DNA of my tumor in my blood, meaning some parts of that tumor are circulating in my blood, and they can recognize usually before they can visualize with like a CT scan. So it's like an early warning. I had gotten 2 NEDs as results for those, meaning no evidence of disease, which I think is the best you can hope for from a ctDNA test. I think this is the 3rd one, and I got a 3rd. This is when I did the blood draw on the 15th of October, but 6 weeks later, whatever they told me, again, NED. One of the problems is that the last one, the insurance denied payment. I guess that would be a good time to remind you that my GoFundMe, gofund.me/C as in Charlie, 9, AA as in Alpha, 3D as in 3D, 84 is my GoFundMe. GoFund.me/Charlie, 9er, Alpha, 3, Delta, 84. That'll take you to my GoFundMe page. But anyway, they denied covering that. And So that'll be a lot of money, and that also means that I will be saying no thank you to the next ctDNA test opportunity because I don't have the money to pay for it out of pocket. Even though I really like it, I was really obviously enjoying getting the NEDs and really liking being on the frontier of science to see if there's a recurrence. Or perhaps see if there's a remission, if you could say it that way scientifically, but see if there's a recurrence before their symptoms and, before it's too late. But it looks like that option will be off the table for me because for some reason my insurance had paid for it, now they won't. So my expectation is they won't again. They've just made that decision. So that's not a fun one to have to report, but there you go. October 20th, I went for my COVID vaccination. Never missed one since this whole thing started. Then I returned, November 7th to Dr. Corwin, the pulmonologist, and that's when we did the lung function test, and that was the second time I've did it. The first time I did it was the first time I met her. This is another time. And again, I was flying colors on everything that they measure in that test, which is exactly what I expected, based on my, martial arts and practices and my sort of self-eval, but it was still good to have it done and learn something. And I had a great experience doing that yet again. November 11th, I went up to Keene, New Hampshire to do a workshop that's called Free Training Day. So perhaps November in 2024, you'll come up to join me. It's free, it's training, and it's a whole day. And just as with going to Philadelphia, to that Free Training Day, that's what that was in Philadelphia, it took an awful lot out of me. It was really hard to do. I had to drive up there. Last year I got a ride up there and I barely made it getting a ride, and I barely made it through anything I had to do, and I just tried to be as vital as I could when I had to teach, and the rest of the time I was just really pretty down. This was getting chemo in early on in the process, so I suppose I could show you that picture that I had up here the other day. Sunday, Monday. Yeah, I don't know if I could find it quickly enough for me doing a video. I suppose I could hit pause. But anyway, the picture came up from the other day of me in the hospital bed. There it is. Got it. So this is December 25th, 2022. So that was my post. I don't know if we could focus it on that, or I'll just move it. But whatever the post says, that's me and Barely Bear. I have no idea if that will focus or not. But that was a year ago and a little bit now. So anyway, when I went up to New Hampshire, that was quite tough, but then just whatever it was, a month or so ago, now I got to repeat it. So that was, I felt like I acquitted myself better. November 21st, I went in for a follow-up with my APRN, so just kind of a looking over everything in general and talk through what was going on and what my understandings were. And there's no changes to medication or anything, so it was more of a monitoring situation, I think. And then Hanukkah, and then so December 12th, I went in for a port flush, which you probably can't see, but there's my port for them to do the chemotherapy. I still don't know if I'm going to get chemo again. But I double-checked that it's okay to keep the port in with no plans to give me chemo and no plans to take it out. And I was told yet again that that's fine. So I'll just trust in that, as I have. But I also did have to I chose to be proactive about getting it flushed, because I have heard that, if they're not used regularly, and I assume when they're used, they get flushed too, that they can cause problems. I don't know what those problems are, but I know it's hooked up to like my jugular. Seems to me like maybe a really good idea to have it maintained. So I was proactive. I asked for an appointment. They were good enough to give me one. I went in on the 12th, and that was good. When I went into the hospital originally, which was maybe December 24th or 3rd, something based on the date of that picture of me in the hospital, I had gone in to get disconnected from the chemo, and then I didn't come home after that. I went into the office, and then I was on an ambulance, and then this whole sort of acute portion of the tale began. That was December 12th. December 13th, I had 2 different doctor appointments. So I'll just start with the second one, which is later in the day, and that was with Dr. Billingsley, the liver surgeon. So that was my 3rd post-op follow-up with him, and I think it's my last. Nobody said that specifically, but we didn't schedule a follow-up, and he seemed to be saying goodbye when we left. A great appointment. He told me that my liver would have healed back with by the time a month had elapsed after the surgery. And I had some questions for him, and he had some questions for me, and he did an exam, and everything went well. So that was good, and I'm super happy with him anyway. In the morning, I'm trying to remember how I got this appointment. Dr. Pantel sent me to him, but I don't remember when I saw Dr. Pantel. Yeah, I just don't remember. But anyway, I got an appointment with Dr. Duffy in Guilford, or at least in the Guilford office. And so it was for a hernia consultation. So when Dr. Billingsley and Dr. Pantel being the GI surgeon, I guess that'd be the term, and Dr. Billingsley, the liver surgeon, who I had just seen later this day, when they closed me up, my understanding is that Dr. Pantel did all the closing, and they left open the reverse colostomy point for it to close itself. But then, where I had 42 stitches, from, stem to stern here, when that was closed up, apparently there's some risk of a hernia following that. So since I left the hospital, I've known that where the colostomy, there's like a bulge there. And what I was told is that people don't get them fixed unless they hurt or for aesthetics. Mine hasn't really hurt, although it feels a little odd. Sometimes it's a little less than comfortable. And more recently, occasionally, like if I cough or have a more difficult bowel movement, it's edging towards a bit of pain, not just discomfort, but not much, not enough to really draw a complaint, but I logged it and reported it. Anyway, I went in to see Dr. Duffy thinking, well, they're going to bring the Da Vinci machine in and go in with 2 or 3 robot arms and then cinch it up with polypropylene mesh, and then I watch out for infection and wait for the healing to happen. And he said we could do that, but he's now seen the CT scan of everything, and he said that there's a couple places on the midline incision that are also beginning to herniate or showing that they will. I don't remember how he put it, but he basically could say, I can see that those are going to herniate. So if I go in and fix this, you'll heal up, and then you'll come and see me a few months later for this, and then you'll come and see me a few months later for this. He seemed to think, particularly because I wasn't complaining, there's no discharge or pain or infection or anything, he'd rather wait to do them all at once. So my blood sugar was a little high. One reason he wants to wait. I want to get my weight more down because I've been working on bringing it up after surgery. That's another reason to wait. But I don't know if part of his reasoning is to wait is for these to show more need to do it. And this can wait because it isn't causing any real pain or problem. So at any rate, he wants to wait until he gets another CT scan to see sort of, I guess, the rate of change with the herniations or soon to be herniations. I don't know. So I told all this to Billingsley, who I saw later in the day, and he palpated and had me cough and felt, and he agreed with the assessment that the hernia doctor had. So that was kind of nice to have sort of a second opinion, a couple hours later. And he said, Dr. Duffy said, if we're going to do the whole thing, we don't just use the robot. It's better just to open everything again, so the whole thing, and start over with the reclosure. So my understanding now is that they're going to do this. I don't know if this part they would do with the robot and open me, or they open everything and they reach over to and it sounded like, as far as I can understand and remember, just open everything up and close it in a different way, I guess. So that's my understanding of how it will go. But he wanted to wait until he had another CT scan to see change and maybe assess when the best time to plan a surgery is. Luckily, I guess for me, I'm planning to have another CT scan before I see Dr. Stein, because that's part of the protocol for the cancer. So he's going to, ride the coattails of that CT scan. And when I see him next, I think we'll make a plan for the surgery. But that's another big surgery. I don't know if it'll be covered by insurance or how that'll work, because I think it's not directly related to the cancer, so it might seem more elective. I don't really know, especially if I'm not symptomatic. So my feeling is that I'm probably looking at a whole bunch of bills I can't afford. I don't know what to do except for do what the doctors suggest and figure the rest out later. I think that was the last appointment I had in December. Yeah, so then that puts us into now. Next week on the 11th of January, I go in for the CT scan. My memory is that it was scheduled as an abdomen and pelvis, but they're going to add the chest to it. So I should reach out to make sure that's happened, that they were going to add the chest CT scan to it, so that they can look at the lung nodule thing again. So that'll be on the 11th of January, and then tax payment. And then the 24th of January is when I see Dr. Stein. Yeah, so I see Dr. Stein again, so I'm going to ask about the ctDNA. I don't think she's going to be able to help me get it covered, but maybe there's some alternative, or she can make an argument. I don't really know. And I'm going to ask about the port. I'm going to ask about my likelihood of chemo. I'm going to ask just the overall, what do we think in terms of the cancer? My guess is that if I'm not symptomatic by then, I'll be shifting into surveillance, where there's not intervention or medication, or there's not intervention including medication. And they'll want to see me, I don't know, every 3 months, 6 months, 9 months, a year, whatever it is, and just do a CT scan and check my blood work and see if there's any reason to intervene. I think that may be what happens. But in terms of, like we were talking about, I was talking about the herniation where the colostomy was, if I get stopped up again, then it's just emergency room, and then they just go in and fix it without making a plan the way we're discussing it. It just has to be right then, so I don't die. Obviously, that herniation can start to impinge on blood flow, and it could impinge on nerves, and it could certainly impinge on the function of the intestines. I think those are the three main things that would kind of send me doubled over to the ER. On the 26th of January, I go back to the pulmonologist. My pulmonologist, Dr. Corwin, has gone on maternity leave and then is leaving the practice. So she's transferring me as a patient to Dr. Imif Bore, who I got to meet when I was in the hospital, and it was one of my favorite doctor-patient interactions. I very lucidly remember our time, and I felt he was so generous and so educational. I really look forward to just seeing him again and thanking him. So it seems like that'll be my opportunity. Again, I expect the GERD thing will not have changed. He will have been able to see the CT scan of the chest, so if there's any change or any other education I can get, we can see. But I imagine they might then cut me loose and say, we don't need to see you again, or we don't need to see you again for a year unless there's a change. That's my expectation. The day after that, here's an ad, I guess, is because I'm looking at my calendar, is the 27th. I'll be doing a Xing Yi Chuan workshop in Ipswich, Massachusetts, at Mark Warner's Professional Martial Arts Academy. So that's Saturday the 27th at 1:30 p.m., a couple hours long, so come on up. We'll probably have a nice dinner after. By the way, for some reason, on the 26th of January, as well as on the 30th of January, I have the pulmonologist in the calendar. And I'm not sure why, but I think it might have to do with, because one's under Corwin, one's under EMF Bore, so I think it might be, one of those is wrong. But anyway, on that week, I'll be back. And then the next one I have is February 14th is when I go see the hernia doctor, Dr. Duffy, in Guilford on February 14th, a couple weeks after the CT scan and the oncology review. So that's the health illness update. I will try and append this to the newsletter, which I have yet to write. So I think this is update 18. You can also see me on patreon.com/somedayfarm, as well as buymeacoffee.com/somedayfarm. Patreon.com and buymeacoffee.com, both /somedayfarm. And you can help out there as a Patreon member. You get a free private lesson every year, as well as whatever else it offers, discounted private lesson rates. And it allows you to support me, which obviously is super needed. Sarah will be having an elective surgery sometime soon, we expect. So we both might be laid up for a while, maybe even at the same time. So we'll be in deep appreciation for people delivering groceries and supporting us in other ways that they can. Patreon members, you get an awful lot of free videos on there, and you get a chance to regularly support me without much effort on your part. So love. Thank you.